Hello, my name is Dylan Holt, and today I'll be presenting my summary of Chapter 1. The main idea of this chapter was to understand how hospitals and other healthcare entities handle their patient records and information. I put HIPAA in these slides because it is the Health Insurance Portability and Accountability Act, which is federal legislation that includes provisions to protect patient information. The type of information that was described in the textbook, as well as the class slides, is defined as protected health information. With this legislation in mind, healthcare entities must work very hard to protect their patient information. Patient records include identification, problem lists, medication record, history and physicals, progress notes, consultations, physician orders, and many more. These patient records can be collected for a number of different purposes, including patient care, communication, legal documentation, billing and reimbursement, research and quality, and population health. All of these can help a business to better understand their population and to run smoother. The organization and origin of patient records is a key area to understand when discussing information systems. Traditionally, these records were kept in a diary-like chronological format, which is referred to as source-oriented. In the 60s, a new form was introduced, which was called patient-oriented medical records, which organizes records around patient problems and not the source of the information as previously done. Though these forms of organizations are not commonplace now, SOAPs and problem lists are still widely used. SOAP is an acronym for Subject Data, Object Data, Assessment of Patient Status, and Plan. The diagram here shows the general flow of care for inpatient care. The left-hand column shows which medical records are added at a particular point of stay. The middle column shows the general flow for patient, and the right-hand column shows the responsible party for collecting that data. This is a general overview of how much information is received, and I really found it important in understanding the general flow of things, which is why I decided to put it in my summary slides. There are many types of forms used, but the ones here were discussed in previous slides, so I figured I'd focus on them. The UB04 and the CMS 1500 are both reimbursement forms used, and their samples are shown here on the right of the slide. These types of forms are for administrative use and are very important in terms of payment. The Uniform Bill 04 is the de facto hospital and other institutional bill claim standard. It is actually required by the federal and state government for their role as third-party payers. The CMS 1500 is a standardized claims form developed by the National Uniform Claims Committee and is the de facto standard for the non-institutional provider claims. The UHDDS, on the other hand, is a uniform data set, which stands for the Uniform Hospital Discharge Data Set. This, along with other similar data sets, are there to identify the data elements that should be collected for each patient and to provide uniform definitions for the common terms and data elements. Other uniform data sets include Uniform Ambulatory Care Data Set and Minimum Data Set. There is a huge amount of information that needs to be documented and stored, and unfortunately, the traditional way of doing this was to have paper databases. Paper databases are not effective for the amount of information given because the whole point is to be able to make quality reports that administration can use to improve processes. Digital databases can decrease repetition from forms that would have previously been overlooked. Simple typos or forgetting a last name can throw off how the other departments view a patient, which can be very problematic, and such examples were talked about within the class slides. What the digital database allows for is the creation of reports such as Medicare cost reports. These databases can also keep track of census statistics, which is the number of patients at a given time, as well as discharge statistics, which keeps track of how many patients discharge over a certain period of time. There are also a number of forms of data made available which are comparative data and information. This type of information includes patient satisfaction, practice patterns, health plans, clinical indicators, and population measures. This type of information can be used for administration as well as clinical purposes by healthcare organizations. So overall, the main purpose of Chapter 1 was to give us a general overview of how much information goes into healthcare organizations and the different strategies they use to collect that and what they'll do when they have all that information available to them. So this concludes the summary of Chapter 1, and thank you for taking the time to listen.